If you want to make a full recovery and significantly reduce your risk of a future knee injury, you need to regain full symmetrical knee range of motion. This is absolutely critical after ACL surgery or a knee injury, yet so many people never actually achieve this and they actually don't make a full recovery. Here's why. Most traditional physical therapy plans fall short, especially if you have active goals. Insurance limitations, busy physical therapy clinics where you're double or even triple booked with other patients, and the lack of qualified therapists who truly understand and specialize in complex recoveries like ACL and knee injuries. For those of you who don't know me, or might be new to this channel, my name is John Kahl, and I'm a physical therapist specializing in ACL and knee injuries. Through my online coaching platform, ACLRx, I've personally helped over 200 active people fully recover from ACL and knee injuries and get back to what they love doing. Now, for the range of motion piece, many people either fall into these two buckets. They're told that they have full range of motion, but don't, or they're struggling to get it back. In this video, I'm going to be covering why getting back knee range of motion is critical for not only improving your quality of life now, but why it's important for future joint health. I'm going to be covering how to self-diagnose your knee range of motion issue. Yes, your issue, you're going to get the exact help you need. And here's a hint. You need a specific approach based on individual factors. We'll break this down. Then, I'm going to discuss what types of exercises and mobility drills that you can use to resolve this based on what you need. And last but not least, I'm going to cover what common mistakes to avoid that most traditional physical therapy plans don't address. So you might be thinking, do those last few degrees of knee range of motion really matter? And I will be the first to tell you that yes, they do. And they are often the missing link that's causing issues and holding back people's recovery. And when I say full knee range of motion, I mean 100% symmetrical to your non-surgical or your non-injured knee. Symmetry is the key. Let's talk about knee extension or straightening range of motion for a second here, because this is the one that is very overlooked a ton by the healthcare field. A lot of my clients who started out in traditional physical therapy for months or even years were told that their knee was straight because they were able to get their knee to flat or to 0 degrees, right? The problem here is that the non-surgical knee hyperextends. So in reality, they're still missing 3 to 5 degrees of extension, and it's a big deal. If we don't have full knee extension range of motion, a few pretty significant things happen. First, your walking mechanics won't be normal. Multiply abnormal walking mechanics by thousands of steps per day, multiplied by weeks, by months, by years, and you can see how this can snowball and lead to long-term issues. And if your walking mechanics aren't normal, guess what happens if you start running, right? Second, your quad muscle doesn't work as well if your knee isn't fully straight. And this can be a full hour-long video in itself, but quad strength is one of the most important things to restore after knee injury and ACL surgery. Failing to regain adequate quad strength will significantly increase your risk of re-injury. And lastly, we also have evidence in the medical literature suggesting that an increased rate of osteoarthritis progression occurs if someone doesn't achieve full extension range of motion. Similarly, knee flexion or bending range of motion plays a big role as well. If we don't restore full flexion motion, our hamstrings and our quads don't work as well as they have less bandwidth and range and excursion to work through, right? So something called the length-tension relationships change, squatting mechanics are altered, and the body will find ways to compensate, especially if you're going to do a task or an activity that requires the motion that your knee just doesn't have, right? Compensation can lead to other joints becoming cranky, things away from the knee like the hip, the ankle, the back, right? So yes, those last few degrees are so important. So now we know why restoring full symmetrical knee range of motion is important. So let's dive in. We're going to talk about extension first. So the first question you need to ask, does my knee extend or straighten, right? Same thing, 100% the same as my other knee when I flex my quad muscle, right? So let's take these examples here. So these were two of my clients who both had ACL surgery and they were struggling to get their motion back, right? And they were months and months out from surgery here. So let's take a look at the image on the right for a second. When I first started working with my client, we did his intake and I said, okay, let's set up the camera in front of your feet. I want you to try to straighten both knees as much as you possibly can using your muscles, right? And as you can see, his right foot here, His heel lifts off the ground. This is what we call like a heel pop, right? This means he has normal hyperextension. His surgical side did not leave the ground at all, right? So he's missing knee extension here. 2 weeks later, through our online coaching process, boom, now we have symmetry. So in this case, if he were to ask himself, does my knee extend or straighten 100% the same as my other knee when we first started working together? The answer would have been no. Now, after 2 weeks of programming, now he can officially say yes, right? Same thing here. This is another one of my online clients, again, who was just struggling to get back full knee extension range of motion. So this is another way that I like to look at it with my clients. I have them prop their heels on a foam roller or a pillow, and basically I let gravity just let their knees sink. I take a look at that, and then I say, hey, listen, I want you to straighten both knees as much as you can here, right? In this image here, the surgical knee is actually the one that's in the back, the right leg here, the one that's further from the camera, and you can see it peering over the top like a mountain, right? And in a perfect world, if these knees were completely symmetrically straight, you wouldn't see the other knee behind it, right? So again, weeks later, after getting on a specific plan, which I'm going to outline here, we are able to achieve full symmetrical motion, right? So back to the flow chart here. So let's take the no route first. Okay, so here's our question. Our knee does not fully extend 100% the same when I flex their quads. Okay, now the next question you're going to ask yourself is, does my knee straighten 100% the same as my other knee when I myself or somebody else uses their hands to help push it straight, right? Pushing down on the knee. Okay, now this is an important distinction because there's going to be two different routes we can go here. We can have an active range of motion problem or a passive range of motion problem. So if the answer is yes to this question, right, this means that our knee can fully extend. It has the capacity to fully extend and be symmetrical. But we just can't access that motion when we use our muscles, when we flex our quad, right? So we have something that I would call an active range of motion problem. So what are some treatment examples here, right? So again, I'm going to link these videos down below, but you're going to work on things like different variations of quad sets, right? Quad set with strap assist. That's one of my favorites. Quad sets with NMES or neuromuscular electrical stimulation, or exercises like terminal knee extensions with a band, right? These are all designed to work on getting active control of your quad muscle to really own that last little bit of knee extension, right? So these are some of the exercises that I would consider using if you have this active range of motion problem. Now, the next question you need to ask yourself is, have I followed a structured, individualized plan to improve this? Because exercises are just exercises, right? It's just like going to the doctor if you were sick and getting medication. Maybe you have the right medication, but if you're not taking it in the prescribed dose that's going to be effective, are you really going to get over your illness? So you need to get specific here. And this is going to really depend on a lot of different individualized factors, but it's important that you have a structured plan that addresses not only how often are we doing these exercises, what type of resistance are we using, if that's an appropriate question to be asking here based on the exercise, right? How many reps, how many sets, and how frequently is this being done, right? If we're following a structured plan that's individualized to us and we give it time, then we ask this question again. Does my knee extend or straighten 100% as the other knee when I flex my quad, right? Let's take the other route for a second, right? Let's circle back here and we're going to say no again. Now you're going to ask this question again. Does my knee straighten 100% as the other knee when I or somebody else uses their hands to help push it straight, right? You're using an external force to see if your knee goes straight. If the answer is no here, so if you push down on your knee and you're like, I still can't get it to match the other side, no matter if I push or someone else pushes, right? Now we have a passive range of motion problem. What does this mean, John? So this basically means that our knee joint just doesn't have the flexibility to get to that symmetrical level yet, okay? So treatments for this are going to be a little bit different. There's some overlap, but the way we program them are going to be different. So something like a quad set with overpressure, right? We're using overpressure with our hands to help stretch the knee. So these exercises are going to be a little bit more stretching or using more mobility in nature because we need to be able to get more motion or more flexibility out of the knee joint, right? We can also do something like the quad set with strap assist, which kind of covers both bases here, active and also passive assistance, right? We can consider things like calf and hamstring stretching, because if we get those tissues that cross the back of the knee to become a little bit more flexible, to decrease guarding, then all of a sudden our knee might be able to straighten more, right? If those things are limiting you, stretch them out, get more mobility, the knee will straighten more. And also something that I like to call a reverse TKE. So it's different than the traditional one. It's actually just doing it backwards. Again, I'll link the video down below, but this is a nice way to work on getting passive motion out of the joint. And again, after this, we have to ask ourselves the same question: have I followed a structured, individualized plan to improve this? Which circles us back to the top of this main question here. Now, let's say we do solve this, right? Now we're like, yes, my knee does fully straighten compared to the other side when I flex my quad. Awesome. So we're almost there, right? This is the major roadblock that we just overcame, right? So now we're going to follow the yes route. Now, this isn't as important, but it's still important. The next question you want to ask yourself is, does it feel the same as my other knee? So we can get there, right? Does it feel the same, right? Now, feel can be a little subjective, so I will say take this with a little bit of a grain of salt, but this is where a knee and ACL specialist can help you decipher this, right? If it doesn't feel the same, let's say you're able to straighten your knees and you're like, wow, I'm able to get there, but it just feels a little tight, or it feels off compared to my other side, right? So then your answer would be no to this question, right? It doesn't feel the same. So some treatment examples here are going to be your active treatments, your quad sets with trap assist, your quad sets with NMES, your TKEs, because we have the motion, we just have to retrain your muscles and regain what we call motor control at those end ranges, in this example extension. We have to regain that end range control, that end range strength. So we're going to use exercises that use our muscles, aka our quads, to control this joint, right? To control that end range. And again, following a structured, individualized plan, we ask ourselves that same question again. And then finally, does it feel the same as my other knee? Yes. Boom, we checked that box. We got full extension. Now, really important. Celebrate your win, right? This is a great milestone, but we have to stay vigilant, because what can happen is you can actually lose some of that motion. Now, this is really important, because it's one thing to check the full extension box with pencil. It's another thing to check the full extension box with permanent marker. Okay? So we might not always keep everything we gain initially. And this is where continuous monitoring, continuous testing is absolutely critical. So now we're going to circle back, coming from the top. Now that we covered extension, let's take a look at flexion. Flexion is important. Just like the other side, does my knee flex or bend, right? 100% the same as my other knee. Here are two of my other clients here. So looking at the left image, again, this is on our assessment call. One of my clients was going to physical therapy for, I think he was 7 months into PT, and we were still missing range of motion. This is a red flag. You should have full range of motion by 7 months after ACL surgery, right? So as you can see here, his heel does not touch his butt, but his other side did. So that's the goal. We need symmetry, right? After 2 weeks of an individualized plan, boom, we were able to touch his heel to his bottom. Okay, same thing over here. Another one of my clients was struggling. He also, I believe he was 6 months out when we first started working together, and he really had a hard time getting his knee flexion range of motion back. As you can see here on assessment, we had a massive gap between his heel and his bottom, and his other knee, his non-surgical knee, was able to touch his heel to his bottom. So big red flag, we're missing a lot of motion here. After 2 weeks, again, getting on a specific plan tailored to his exact needs, he's able to sit on his heels, and we check that box, right? Back to the flow chart. Does my knee bend or flex 100% the same as my other knee? So let's take the no route again, right? So let's say, John, no, it does not. Okay. Now, the next question you're going to ask yourself is, does my knee bend 100% the same as the other knee when I, myself, or somebody else uses their hands to help push it? Right? So let's take the yes route. Let's say yes. Let's say I can bend it. It doesn't quite get to where the other side gets when I just bend my other side using my hamstrings. But if I take my hands and I pull it in, I can get it to be symmetrical, right? So now we have an active range of motion problem, because this shows us using an external force of our hands or somebody else's hands, we're able to get symmetry. It's there, right? The joint can move through that motion. Our muscles just can't activate to get to that motion, right? So we have that active range of motion problem again. And just like the extension, we're going to choose treatments that are aimed at regaining muscular control of those end ranges. So things like deep squatting variations or deep lunges, right? And also things like end range hamstring curls to really just own and get strong in those terminal knee flexion ranges so that we can own it, right? And just like everything else, have I followed that structured, individualized plan to improve this? Okay? If you have, then you go back and you ask yourself the same question again, right? Now, let's say no. Let's say we did this and let's take another example, right? We do not have full bending, right? It does not bend the same. Ask yourself this question again. Does my knee bend 100% the same as my other knee when I myself or somebody else pushes on it, right? Can we squeeze it in and get it? If the answer is no, so no matter how much you pull in or no matter how much someone pushes on it, right? Don't be too aggressive. Not a good thing. That's a topic for later in this video, actually. Don't be too aggressive. But if we're not able to get there with our own hands or somebody else's, then we have a passive range of motion problem, meaning that our joint just doesn't have the availability of motion, the flexibility, the mobility to get to where it needs to be. Passive range of motion problem. So these treatments are going to be more stretching based, right? Active and stretching based, but we need to get more mobility in the joint, so we're going to use more mobility slash stretching drills here, right? So things like heel slides or knee hugs with tibial rotation, prone quad stretch where you're on your stomach and you're stretching your quad out, right? Quadruped sit backs, and also things like rocking on the bike, right? This all depends on how much motion we're missing, where somebody is in this journey, but any one of these things might be appropriate for you based on where you're at. But again, what do all these things have in common? They're aimed at improving knee flexion, passive motion, or like they're more like stretching type exercises, right? Okay, we followed our nice structured and visualized plan. Now, taking it back to here, let's say yes, my knee bends 100% the same as my other knee. Yay, celebrate your wins, right? We're going to follow over here to the yes. Now, my other question here, again, not as important, but still important, right? An ACL specialist, a knee specialist will be able to decipher the degree of this. And again, can be a little subjective here, but I still believe that it's important because does it feel the same as the other knee, right? This might take a little bit more time. So it's important that we get the motion. That's the more important thing. But we want them based on feel. We want these joints to feel pretty darn normal, right? So if the answer is no, again, we're going to opt for a more active approach, right? Deep squats, deep lunges, and range hamstring curls. Follow a good program, ask yourself that same question, and then boom. If the answer is yes, hooray, we have full flexion range of motion. But again, just like extension, we need to monitor it. It needs to be measured. You need to stay vigilant because you might not always keep what you gain and you might lose it a little bit. So you have to stay vigilant. Remember, we're checking this box with permanent marker, not pencil. So how about some common mistakes here? So now that we've covered the logistics of what we need and how to get it, let's talk about common mistakes that I've heard countlessly over the last 8 years working with ACL and knee clients. The first one, being too aggressive. This is incredibly common, and I hear it from a lot of people after ACL surgery where their physical therapist aggressively stretches their knee to quote unquote break up scar tissue. Now, this again can be a completely whole video in itself, but I hate to burst their bubbles, but nobody is breaking up scar tissue with their hands. I'm telling you it's not happening. We have research showing that it takes tons of force to deform human tissue by even 1%, right? What's likely more happening, right? That's not to say that it doesn't help. What's more likely happening with range of motion and stretching is two things. Scar tissue remodeling, right? Tissue elongation, and a physiological phenomenon called neuromodulation. Again, a topic for another video, but it's important to note this because if we think that we're breaking scar tissue by aggressively stretching our knee, this is going to feed into somebody being very aggressive, right? But if we understand the underlying mechanism where it's more of a remodeling, a scar tissue remodeling, or a tissue elongation and neuromodulation, if we understand that there's another more likely plausible reason why we're getting motion from stretching, from range of motion stuff, right? We're less likely to be aggressive. Because, again, this is a topic for another video, but because being aggressive is a big problem. Because let's say we push really hard to get our knees to bend or to straighten, right? In the moment, no matter how much you try to relax, your body will subconsciously guard. And it's going to contract your muscles to fight the stretching force if it's too aggressive. Afterwards, and this is typically the following day, any range of motion that you got, you're going to lose it, right? And your pain levels are going to go a bit up. And your knee's going to feel even stiff again, right? And then your swelling might even increase. And it never really improves over time. And it might improve in the moment. You might be like, well, when I aggressively stretch it, John, when my PT stretches it, or if I really push hard, it gets better, right? But it's really all this other things that happen afterwards. The pain, the swelling, and the stiffness are going to come back full force the next day. Because if we're not respecting pain, if we're not respecting swelling, and we're not respecting an increase in joint stiffness from our baseline, and this stuff is hanging around, regaining full range of motion will be like pushing into a brick wall. You're going to be going nowhere fast. So being too aggressive is very counterproductive. Now, with that being said, this process, especially after surgery, won't be pain-free. And that's okay. But we have to be realistic with what's acceptable and what's not. Some level of discomfort, tightness, and even some pain can be expected, right? A qualified ACL and knee specialist will be able to decipher that for you. Let's bring me to common mistake number 2. Ignoring what your knee is telling you. Circling back to pain, stiffness, and swelling, if these 3 things are lingering longer than they should, they're getting worse after physical therapy, they're getting worse after exercising, stretching, whatever. This is your knee's way of saying, like, hey, I'm not happy with what we're doing, right? And an unhappy knee will never grant you full range of motion. So pain, swelling, and stiffness should be measured. What's being measured is being managed. Which brings me to common mistake number 3 is progress needs to be measured. If it's not, how do you know where you're truly at? How do you know if the plan is working? And how do you know if you'll ever meet the goal you need to achieve, right? Measuring is absolutely key. It's non-negotiable. We need measurements. Otherwise, we're just guessing at best. And guessing, especially in ACL rehab, guessing is going to lead to the poor outcomes that we see in the medical literature, where people never get back to what they love doing, and unfortunately, a sky-high re-injury rate. Okay? Get assessed, get measured. Don't guess. Common mistake number 4 is not using a structured research-based plan to address range of motion issues. Here's the 3 key ingredients to improving range of motion. Number 1, choose 1 to 3 exercises that are appropriate for you based on what you found in our video today, right? There are dozens of different exercises that you could use, but you want to select only a few. This way you can put your full effort into doing them to get the job done. Number 2, the magic recipe is consistency and volume. You want to get into these positions and do these exercises multiple times a day, staying consistent over time. The more frequently you bend or straighten your knee, the quicker your body will see these movements as normal and keep those changes. And number 3, we want to strengthen in these newly acquired ranges. Strength and control is the glue that makes these changes stick. And there you have it, my knee range of motion masterclass. If you found this useful, please like, share, and subscribe. It took me a while to put this together, but hey, I'm here to help as many people as possible fully recover from ACL surgery and get over knee pain and knee problems. So, if you're struggling with range of motion, whether you're months out or years out from surgery or injury, and you've tried everything under the sun, click the link below, schedule a call with me, it's free. Let's figure out the bottleneck in your recovery. Maybe you're planning on having ACL surgery soon, or you just had it recently and you want to make sure that you don't fall victim to a busy physical therapy clinic where you're just another number doing the same exercises as grandma next to you. I've got you covered. Active goals require a specialized approach. Click the link below to schedule a call so I can learn more about your situation to see if I can help you get back to reclaiming the life you once loved before this injury. See you guys on the next video.